Good day. Today we're going to perform post-mortem care. The purpose of this first is to help in aids the physical appearance of the deceased, also to prevent discoloration and damage of the corpse skin. Also, we need to ensure or secure the personal belongings of the deceased and to give comfort to the family and to show respect to the deceased patient. The goal of this procedure is to determine and understand the role of the nurse during the dying process or death. For assessment, we need to review the hospital's policy about the post-mortem care, and then we need to check for the vitals of the patient. And then notify the physician. And then we need also to assist for the need of autopsy if the patient's death occurs within the 24 hours of the hospitalization. For outcome identification, we need to ensure that the body and the environment are clean. And then we need to make sure that the family views the patient without any signs of distress. And then also we need to make sure that there is no contact with any body fluids. First, for implementation, we need to record in the patient's chart the time of death announced by the physician. And then we need to notify the family of the patient about the patient's status. And then we need to go back to the room, close the door and the windows to provide privacy. And then we need to perform hand hygiene and gun gloving. Next, we need to remove tubings from the patient, such as IV lines, NGT, urinary catheter. And then after removing those tubes, we need to dispose it properly in their designated receptacles. And then after that, we need to hold the eyelids of the patients closed until it remains closed. If it doesn't close, put some cotton balls or moist cotton balls on their eyelids until it remains closed on its own. And then if we are unable to remove the tubes, we need to cut the IV lines and then place or cover 4x4 gauze pad. And then for the catheters, we need to coil it and then tape it down. Next, we need to remove the unnecessary equipments in the room. And then we need to wipe the secretions from the face and the body of the patient. And then we need to change the linens, the soiled linens with new ones. And then we need to place a linen cover or linen saver under the body and the extremities of the patient if needed. And then we need to place back the dentures of the patient into their mouth. And then if the mouth doesn't close, we need to put towels or pillows under the chin of the patient. Next, we need to remove all the jewelries of the patient and then except the wedding band, unless the wedding band is requested by the family. And then we need to record the name of the receiver, the time and date they received, the personal belongings of the deceased, and then their address as well, or in contact number. Next, we need to put clean top linens covering the body of the patient with face exposed, and then place a chair along bedside, and then dim lighting. And then after that, after the family has been viewed the body, we can now place tags with proper identification of the patient. Next, we can now send completed the certificate or completed papers to the funeral home. And then we need now to close the doors of the room. And then discard all the materials used in their proper receptacles. And then we need to have the room cleaned. And then remove gloves and perform hand hygiene. For evaluation, we need to evaluate if the desired outcomes are met. And then we need also for documentation, we need to document the time of death and code of information, the notification of the physician and the family, the time where the body was removed in the room, and then the place where the body was transferred.